this is very tricky because now we're dealing with partnering with rehab professionals in our local area, but then also working with a surgeon who is out of state, and this athlete will leave us at some point and go back out of state. Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. I'm excited about this podcast topic because it is fresh. It just happened this morning, and I have to share it with you guys. It's all about collaborating with other healthcare professionals and how to do it seamlessly. And it's live, and it's how I manage athletes. It's how I mentor my team to do the same thing. And I'm excited to share it with you, listeners. So if you guys don't know, I have this also recorded on YouTube, so you can head over to my channel and listen there as well. But what is new in life? Before I go on to the podcast, what is new in life? Let's see. A lot of moving parts with just my personal life and with sports performance company, and just a lot of moving parts. One of the big things that we are trying to do is really help grow personally and professionally. And so we have a lot of people doing new tasks, new roles, and so that requires different processes, and what worked in the past didn't anymore. And so that's been really exciting for me as a coach, as a mentor, as a leader, to help other people grow. And I think wherever you are on your professional journey, you'll hit those time points. Maybe you want to become a director, maybe you want to become into leadership or mentorship, or you want to start doing more CEUs with your company, whatever it is. There's different points where you're going to start to advance professionally, where you're like, I want more. I want to do a little bit more. I want to be able to advance and grow with the company. And that's currently happening. And that's really exciting. And there's just a lot of moving parts in order for that to happen. So behind the scenes, just been busy with that. My kids are doing great. My son, I was trying to look for him. I thought he would be around here, but he is, the cool part is his hair is getting so long in the front. He's got a kind of this like party in the front and then business in the back. It's getting so long that the front part is covering his eyes. And so today we actually did a little man bun for him. So that's doing great with Jacob. But nonetheless, let's get on to the podcast. Collaborating with other healthcare professionals. I've done podcasts very similar to this, and I want to explain the case. So to give you context, because I think it's very important to understand why I do these podcasts is really what I'm hearing, what I'm seeing, and what's truly relevant to you as a healthcare professional, whether in your PT school or your established PT or new grad or whatever it is. So here's the scenario, and this could be applied anywhere. So we have an ACL rehab progression that we want to do. So it's pre-op. And so we've been managing pre-op, get range, teach them everything they need to know about going out into surgery, and now what to expect afterwards. And this parent and athlete said, hey, we want to be able to come see you, but for logistical or financial challenges, this might be a little tough. So we need to have something closer to home, whatever it is. And they decided, okay, so we want to be with you, and we understand we've mapped out the whole year of what it's going to look like to get back to high level sport. And everybody's on board, except now they're like, well, if we need to go through our insurance to try and get something closer to our home, how do we manage that? Who would you recommend? And of course, you as a provider, you instinctively want to say like, well, I think that we can do the best, but here's the deal. That's not what the parent or athlete is asking. What they're asking is, who else would you partner with to help me get my athlete or my kid to the point that they want to get to? That's the way you got to understand the question. And that's the problem for a lot of providers, is that your ego gets in the way. I posted on something recently earlier this week. And so this case just kind of like seals the deal. It's like, it's hitting you multiple times a week. You got to explain it. You got to say it. People only ask the question the way they know how to. And so this parent is asking basically, who can we collaborate with to ensure that their daughter or their son is safe? Beautiful question. All right, great. So we have people that we've partnered with in the past. So we're going to send them over and we're going to collaborate. So the deal is we've done the pre-op. We know what a whole year looks like to get back to soccer, basketball, training, lacrosse. So when we map out that whole scenario, our goal is to be able to look at specific timelines and measure it. Now, I've mentioned this before. The challenge and problem with PTs is that we're so narrow focused on the darn region, right? Like the knee's gonna get better. We're working on the range, working on this. And it's kind of hard because insurance focus you, tells you to focus on like what's the measurement, how much is the edema, what are we talking about, blah blah blah. So you're so narrow focused, but the problem is sometimes you just need to take a look backwards, and requires a lot of pre-planning on at week 6 what needs to happen, at week 12 what needs to happen. And this is where the challenge becomes with a lot of orthopedic clinics who don't treat a lot of athletes. You become kind of like a 12 to 18 week specialist, and we can't think past that because a lot of times insurance is the barrier. And so if you had an opportunity to take somebody a full year out, what would you do? And you actually had to plan it, not like, well, let's try this week. Let's try. That's typically what I say. Well, let's see how it goes this week. No, let's see how you can pre-plan a full year. When would you go back to soccer? When would you go back to contact, non-contact? When would you put them in a bib? When would you do long kicks? When would you do, if they're a goalie, when can they dive? All these questions need to be mapped out. Why? Because they need targets to be able to hit. And this athlete that we're talking about is very high level. So we're trying to figure out how can we map this out for a year, because their timeline is actually cutting it very, very close to the time that they need to get back to season. And so we mapped it out. We looked at the whole year. We did pre-op. We now have this whole roadmap. And now we got to partner with somebody who might not see the value or think about or have the opportunity to look at that whole roadmap. So what do? And maybe you're listening and you're like, well, I'm actually at an orthopedic clinic where I might not be able to see them past 12 weeks just because that's what I see. Okay, great. Then the context for you is the flip side. What if somebody's asking you, hey, can we collaborate? I can help and I'll kind of oversee the roadmap. Can you help in between there and help facilitate and keep me posted or whatever it is? You can't let the ego get in the way and be like, I understand that, I can help. And that's where you as a clinician need to understand where your role is. And the way we see it at Sports Performance is two different words that we use to describe it. Who's the captain or who's the main chef? I use the word chef because it's like we're cooking, right? And you have like a sous chef and you have all these people are trying to make a meal, and one person just needs to be at the top overseeing what's happening. And most people say, like, wasn't that the surgeon? No, not necessarily, because they're not watching. They just did the work. Now they're all like, just don't mess it up. That's basically what they're saying. So that part's been done. If we assume that workload has been completed and it's solid and intact, what needs to happen? So if we're talking about an ACL, we're going out a full year. And if the surgeon does their work, perfect, let's do it. Now it's up to the rehab specialists or their healthcare team to make sure that they're solid. So the question becomes, who is the captain? Who's the chef? And when you've done the pre-op, you've done the whole map, you are that person. Why? Because the athlete, more than likely, is at the center of it and they have no idea of what's going on. You need to be the person who's kind of like, who's lining up the surgeon? Who's lining up? Are you meeting with the surgeon? Are you meeting with your other rehab professionals? Or maybe they they move out of state, and this person is actually going to school out of state. And for us, this is very tricky, because now we're dealing with partnering with rehab professionals in our local area, but then also working with a surgeon who is out of state, and this athlete will leave us at some point and go back out of state. You better believe there has to be one person captaining that whole thing to make sure that this person doesn't slip through the cracks. And the problem is that in orthopedic settings, the volume is so high, it's a special case. If the rehab primary rehab specialist doesn't care. This person will slip through the cracks. Their range of motion will be crap. Their edema will be high. Their strength won't be there. They won't hit certain timelines, and you put them at risk for re-injury. And that is selfish. Now, learning a lot of this in the professional world of, professional tennis, professional soccer, watching people slip through the cracks is one of the worst things that you can watch. You're just seeing it happen, and you just got to say, like, how do I prevent this? How do I not be that person? And after a decade of working with these individuals, I've learned just take control, and somebody has to do it. It's for the person's own good, and they love when you do that. You just got to make sure that somebody else doesn't understand that they're the captain. You just got to be on the same page. So what we're going to do with this person, we're going to line it up. We're going to map this whole thing out. ACL progression, returning out of state at, month 9, 10, 11, kind of critical months. However, who is the captain? And that person has to serve that role. So we're going to partner with other rehab specialists. So now line them up, communicate that to them. Hey, here's the situation. Going out of state, lined up the whole year for you. They're going to be with you likely for the first 12 weeks, maybe even 16 weeks. Here's the type, whether it's patellar tendon or hamstring. Here's the progressive here's the timeline. They want to be able to return to sport at this month. We got to work backwards. In an ideal world, we like them linear running by week 12 to 16 based on their surgical type. Line it up for them. Make it like so easy that you hand it to them and they just knock it out of the park. Just lob it up. And if a rehab specialist, another clinician, has a problem with that, that's their ego. If somebody said that to me in a very professional manner, hey, listen, I've got an athlete, they live closer to you. I've already been seeing them. They want to continue seeing me. I've already built this out. They're going to be doing this. I've talked to the surgeon. I've talked to this person, and I've been part of that whole process. I could use your support to manage this athlete. If somebody said that to me, I'd be like, good for you. Where do you need my help? Because I'd let my ego go and been like, what do you need for the athlete? I'm here to help, because it'll come full circle. And when I'm a team player, later down the line, I might be the captain. And that's the way you have to see it. Are you the team player or the captain? Or you refuse to be the team player and you want to be only the captain? I think that's really selfish. And no offense to PT schools. I think PT schools put us in a position to think that we are all the time. Between us and the surgeons, like it's not like that. Especially when you're in the professional world. It's definitely not like that. Everybody has specialties, and it's about what the athlete needs at that time. So maybe this person has a nutritional challenge, or this person needs more acupuncture. This person has, anxiety, stress, sleep deprivation, and the acupuncturist takes on that role. Like, there's different times and different days when you've got different captains leading whatever it is. But from a strength perspective, the strength coach would take that, right? But when it comes to rehab, you kind of need everybody's help. Like, what if they're working with a massage therapist or another PT or an athletic trainer at a high school? Those are all different people. So who's taking the main role? You got to decide that. So collaborating. So if you're the captain, what you need to do is make sure that you line it up. It's all about who's the decision maker in the athlete. So for the athlete, if it's a youth athlete, it's the parent. If it's an adult, perfect. You're communicating with them. In this instance, we're communicating with the head honcho, the parent. So we are talking to the parent and letting them know, hey, this is what the plan is. We've mapped this out. ACL, they're going to return out of state at this month. We'd like to get them, contact in a bib, modified, and 90% back to return to sport. In order for that to happen, this has to go seamlessly backwards. I will work with the strength coach at the university or at the school or at their pro setting to ensure that things are happening. I will communicate with them to let them know what strength programs they would like to do in conjunction with us, if that's a thing. I will integrate their strength programs at week 3, 4, 5, 6. I've already called them. I talked to them. I've talked to the surgeon. Here's how the lineup of they want a conservative rehab progression. They don't want to running until week 16. That does push us back a little bit. I've also partnered with another rehab specialist that's closer to you guys. So from there, they will be seeing you 3 to 4 times a week or 1 to 2 times a week, you will be doing check-ins with me remotely or whatever it is, 1 time a week or every other week or once a month. I will ensure that the strength coach is doing this. I will ensure the rehab specialist is doing this. I will talk to the surgeon to make sure that the athlete's doing this. And I will communicate with the athlete to make sure they feel good with all this and that they're actually progressing appropriately. Now, when you do that, there's multiple steps that happen there. You had to decide what was the right protocol at the right time. You're hoping that your progressions are on point, because if not, you're going to get some backlash. You got to make sure you do your homework with protocols, latest research, timelines, all those things, and make sure that time-based matches criterion-based. So from there, if you've done all of that, now you have to have those discussions with all those individuals that's part of that team. Now, the best way you can go back is letting them know you don't have to come in forceful. I think that'll help like nobody. And explain your situation. Here's what's happened. The parent has reached out to me. Here's where I can help. I've already mapped this out. I've done all the work. I'd love to help, partner with you. Here's kind of what our forecast is, what I've talked with the surgeon on. This is what I talked to the parent on. This is what we like to be. And I'd love for them to see you, and they'll also be seeing me as well. And when you line it up that way, and you're not saying like, hey, I'm taking over everything, you're just doing this, that doesn't need to happen. You're collaborating. I'd love to chat with you, weekly, via email, text message, whatever it is. Make it easier for them to succeed. I think when you come in from that approach, you have to. So the worst thing you can do, maybe like with a strength coach along the way, you can't tell them what to do because that's not your specialty. What you can do is ask them, hey, listen, I have a general outline of what I'd like to do strength-wise, and I'll work on BFR and quad strengthening and hip strengthening, all these other things. What, from a strength perspective, do you want me to add into the program? See what you just did there? You're saying, I have some stuff. I'd like to include your stuff in it as well. You're not saying, I don't know what to do with strength. You're not saying, I'll take all the strength and maybe I'll let you, have some input. That's not the point. The point is, how do you use all these people to help you be more successful for the one most important person, and that's the athlete. So it's a way of phrasing these things. Talking to the doc, hey doc, here's what's happening here. I'm going to be seeing this athlete. They don't live so close to me, or they want to use somebody else in a different network or in network or whatever it is. I'd like to still be part of this. I've managed this person. I've spoken to you about it. I've talked to the strength and conditioning coach. The parents are in line with us. This person's going to be managing all the soft tissue stuff, the range of motion, and everything up until week 16. I will take them afterwards, and I'll take the lead and charge on that. But I will also be doing bi-weekly checkups, monthly checkups, whatever it is, to ensure that the right time. So what I'm doing, I'm just seeing the map, and I'm just making sure that they're hitting the timelines. I bet that surgeon is like, I want you on my team. 100% do that. Just make sure everybody's on track. What you just did was to make sure that like their job looks good too. That's why you have to see that. So that is literally how you line this up. And we had a discussion today on how you would set this up. And this is literally what I told my team. This is how I'd line it up. If this is my athlete and I'm collaborating with somebody who's, in a different clinic or across the way or in a different location, this is how I'd line it up. And you try and have that phone call. Email is always a little hard. Text message, written content comes across at, people get really offended if they read it at the wrong time with the wrong emotion, wrong energy, blah, blah, blah. So that's why I like a phone call, because I can have that discussion and be like, hey, I'm not trying to overstep any bounds. I literally just want to work with you. Here's my situation. And when you come in like that, people love that. And people love people who are genuine and they want to help people. And that's how you collaborate. I mean, there's no secret sauce to it. You just got to be human and think about the athlete and like, hey, I'm really excited about this athlete. I really want to be part of this. I'd love to partner with you. Just use that line. I want to partner with you. Perfect, man. I am excited about that. Let's do it. How are we partnering together? So that is how you're going to partner with healthcare professionals. And in this case, it's going to be other physical therapists. It's probably going to be an athletic trainer across the way at their university. It's going to be their strength coach. It's going to be their athletic trainer. It's going to be their surgeon in a different state. And then locally, it's going to be another rehab specialist. And the parent. So you've got numerous people in those relationships. Ultimately, you're managing all of those the same way. Now, this is a lot of work. I got to admit, you're talking to like 6 different people to manage one human being. you got to keep everything, I think, electronic, because I think that's what's really going to keep you in a position where you don't have to, do numerous things or whatever it is. So I would say hands down, phone call to start the conversation, email is going to be great to keep everybody in the same page. And then also, I mean, text message is a little bit more time intensive. I don't think you need to go there. Sometimes surgeons prefer that just because they're on the go and everything else. You accommodate to the person. However, I would say phone call to start the relationship, emails to make sure that everybody's on the same page throughout. And that requires that you create one master Google Doc or Google Sheet or Microsoft Excel sheet that has the progression, so everybody knows what's happening. And this is what I tell my team. Everyone needs three things to succeed. Everyone needs three things to succeed. Every athlete, every patient, every team member, every colleague, whatever it is, if you're giving them something to do, right? You're going to give them the goal. Hey, at week 3, I want you to have symmetry with swelling. Okay, great. Now they need resources. So how are you reducing that swelling? Are you using a brace? Are you using a wrap? Are you doing soft tissue work? Are you, elevating your leg, whatever it is? So you need the goal, you need the resources for them to do that, and you need the timeline by 12 weeks, by 16. So if you give people targets, like here's the goal, great. Like by when? Oh, well, here's the target timeline. And then lastly, what's the resource? So you got to create a document so everybody understands where it is. And if you do that, how do you fail? It's just people aren't executing the timeline. And if you set that up, it's a lot of work. Guess what? You get to use that for future athletes as well. So it is a lot of work. However, it is a great time or investment in how to use your resources. And this is how you get more athletes on your table. This is how you get people referring to you. If you're looking to work with more athletes and high level or patients who are motivated, or semi-pro athletes, collegiate athletes, whatever it is, this is how you earn them, and then this is how you maintain them. Two different things, two very different things. So I hope this helped. I mean, I think that when you look at collaborating, it's not something that is really taught in school. I think PT school teaches us to kind of be this, high and mighty top of the food chain. And I don't think that's the case. I think that when it comes to, managing cases, I think it's case by case, and where are they on the injury spectrum, how close to return to sport, because then at some point we will fall off and it becomes the responsibility of the strength coach, the fitness coach, and the technical coach to do that last little bit. You're just ensuring that those marks were hit, and then they get to take the rest. But early on, it might be the surgeon and the PT and the athletic trainer. All you guys are kind of working together. Middle of the road, you're getting the PT and a little bit more strength coach, and then you start to wean towards, engaging with the coach and letting technical skill and developing contact. And now you're the PT slowly starting to wean off. Strength coach takes it on, technical coach takes it on. The athlete is just there, and they're just doing fitness, and you're just there for like monthly checkups, bi-weekly checkups, making sure that things are good. So along the way, you should never be on an island. Professionally, you shouldn't be. Don't try and be. I mean, you're going to learn from these people. You're going to create a network and create resources. And when you do that, you actually create a reputation for yourself, and people want that. They want to know, how do we use a network of people to accomplish goals? You won't always be the superstar, whatever it is. You got to be the person who can adapt to any environment, and that's what makes you phenomenal as a sports specialist, as a sports expert, whatever it is. Just know you can't do it by yourself. If you do, you'll be drowning in no time. I promise you. Learn how to work with people in your local area, partner with them. Don't be afraid. And number one rule, call them, let them know. Walk into their office. I would love to partner with you. I've got a certain number of patients that would be great. I don't want to have it where I don't trust anybody. I want to set up a relationship. How do we start that? And when you come in like that, people love you. I promise. Give it a try. Send me an email. Tell me, that it's worked, or tell me some progress with, how that goes for you. But ultimately, use it. Don't try and do this on your own. I promise you, you're not going to be a good place, and you're going to limit your growth. So there you have it. Treat your athletes right, collaborate with people, and that is what's going to set you up for success. I'll catch you guys on the next episode. Take care.